Okay, so yeah, I'm going to be talking about the work that KombineDBrain and all of our member organizations, including the KCNT1 Epilepsy Foundation, have been doing over the past year and a half to build a biorepository and then from there work towards biomarkers. As David Bearden just mentioned, biomarkers can help us realize whether a treatment is working way faster than just developmental outcomes. So this is something that could be super important for our population. So the project that KombineDBrain has been doing for the past year and a half has been with the help of multiple different pharmaceutical company partners, funding a pre-competitive project trying to find biomarkers mostly in blood plasma, but also in other samples, see if there might be proteomic profiles corresponding across a whole bunch of different neurodevelopmental disorders. So we wanted to find biomarkers of disease progression or to be diagnosing or differentiating one related disorder from another, or even to look at treatment efficacy or toxicity of various treatments. In order to do that, we have collected blood samples and then also a lot of patient information, including seizure surveys, the Vineland, and medical information and their genetic variants. We started off with the goal to collect from around 25 different groups, but we ended up with 38 of our member disorders all participating. The goal was to have 20 samples per disorder. In some groups, we well surpassed that, others didn't, but that was about the goal, was 20 samples per disorder, as well as a large number of unaffected sibling controls. Our goal was 40. We ended up with well over 100 because all of these brothers and sisters want to help their sick sibling. So the way the collections worked was a kind of novel framework here where anytime any of our member disorders was having a family conference, KombineDBrain would show up and collect from families there. And we invited families who were from other disorders in the area to show up to the conference and have blood collected. So for example, for DYRK1A, yes, there were around 40 DYRK1A families there, but also I think it was around 30 other families with a whole variety of different disorders showed up at that conference. And so we were able to collect pretty efficiently across the country. So even though these are all rare disorders with maybe around like 100 patients in the US, we were able to basically go to wherever they were and collect there. And then for patients who either didn't live near any of these collection sites or their kids were too sick to travel, we also had the option of home phlebotomy visits. So this is a mobile phlebotomist would go directly to a patient's home, or we could collect from clinicians at medical centers. And families, they were amazing with this. There was one family that drove 10 hours each way to have their child participate in this biorepository effort. So it's been truly amazing, the work that between what Sarah and Allie and Justin have done to get the patients motivated, and also then to drive out and travel here. The types of samples that we've collected, again, primarily we were doing plasma, but we also collected some whole blood so that can be used for genomic studies. Collected urine, dried blood spot cards from like a finger prick, and for some patients we were also able to collect peripheral blood mononuclear cells, PBMCs, so these can be reprogrammed to iPSCs, and we have a couple variants for KCNT1 available. And here's like some of our groups that we've collected. The goal, you can see, was 20. Some groups we got well over that, others were close. KCNT1, we ended up with 11 at the end of collection. But you can see that we got a whole bunch from like so many different disorders here. And then regarding like timeline here, so it's 11 KCNT1 samples that were included in the proteomics scan. This is going to look at 7,000 different proteins in the plasma. The samples have already been shipped out to SomaScan, and we're hoping to get the data in the beginning of July. We're also doing metabolomics, and these samples should be shipping out soon. We'll actually have 12 KCNT1 samples included because we were able to collect from another patient after the first batch of samples went out. And we're hoping to do some metabolomics work as well. And a different project that we're doing, I just want to mention that there is a EEG bank that is in progress. So we'll hopefully be collecting EEGs from hundreds of individuals, including some KCNT1 individuals. And so those could then be analyzed to try to find EEG biomarkers. So that's that. It's been a huge effort from all of the families and from the foundation.